When I'm going over someone's recent blood work with them, one of the biggest concerns that people tend to have is about their total cholesterol levels. I mean, I can be telling them that they have some anemia that they didn't know about, or diabetes, or some underlying infection, or autoimmunity that they didn't know about. And the response is, unfortunately, seems to be centered around, okay, yeah, but what's my cholesterol level? And it's a big determining factor as far as, whether or not people should go on medications to prevent cardiovascular risk is this total cholesterol level. So the number seems to always center around like less than 200, right? Less than 200 for your total cholesterol is a good value, but that is not what the large scale, broad-based population studies seem to suggest. In fact, they suggest that you're better off with a total cholesterol level of around 240 than you would be, with a level of like 160. And now you might say, well, right, but it should be an individualized basis. And I totally agree with that. It should be an individualized basis. So let's not make your determination of whether or not your cholesterol level is healthy based off these broad-based population studies. But since that's the thing, what I want to do is look at those studies in this video, but also stick around for the end because I want to show you a couple of different case studies at the end of this video. So if you do an online search for what is the optimal cholesterol range, you'll see answers like this, or like this, or charts like this that say that total cholesterol should be less than 200. Now these are wide, sweeping recommendations that are supposed to be applied to everybody. But the reality is, it's much more nuanced than that. The idea of the physiology of cholesterol is much more complicated than that. And you should always be taking your values in terms of contextualizing them to you as an individual. But since these wide sweeping recommendations are out there and people sort of like use them as the Bible for determining whether or not you're healthy for cardiovascular risk, let's take a look at some of these wide sweeping recommendations based on these studies. Because again, unfortunately, if you look at LabCorp or Quest, this is what they use to say, oh, you're above the threshold of 200. And it's also, you see it online everywhere. And unfortunately, a lot of healthcare providers use it to determine whether or not people should be on cholesterol-lowering medications. Now, as I mentioned, most research says that you'd be better off with a cholesterol level of 240 compared to a cholesterol of 160, which is definitely against the grain of what you see online everywhere. So, for example, let's look at this study on more than 25,000 Americans. They looked at the relationship between total cholesterol levels and mortality over a 15-year time frame. So they provide this little graph, total cholesterol on the x-axis, risk of dying on the y-axis. And then you can see on the graph with the line, the higher the vertical displacement on the y-axis equals a higher risk of dying. Where do you want to be on this chart? The results of this study suggest that optimal total cholesterol is somewhere between 175 and 270. And the authors of the research conclude, our findings indicate that total cholesterol levels might be a critical risk factor in the general population, and total cholesterol levels less than 200 milligrams per deciliter might not be indicative of good health. Remember that quote. Levels less than 200 might not be indicative of good health. But that's just one study, you say, right? Surely that's an outlier. Maybe looking at 25,000 Americans over 15 years isn't a big enough sample size. Okay, let's look at another paper looking at 12.8 million adults over a 10.5-year period. This chart looks almost exactly the same as the last study. There's a U-shaped curve where too much cholesterol is associated with higher mortality, but a lower cholesterol seems to be associated with an even higher level of mortality. And in this paper, they report the optimal range to be somewhere between 210 and 249. And this paper was also kind enough to break it up into age groups. And there's slight differences in age groups, but nevertheless, a U-shaped curve still persists. And again, the authors of this paper conclude U-curve relationships between total cholesterol and mortality were found regardless of sex and age. Total cholesterol ranges associated with the lowest mortality were 210 to 249 milligrams per deciliter in each sex-age subgroup. And then they sign off saying total cholesterol levels less than 200 milligrams per deciliter may not necessarily be a sign of good health. So total cholesterol levels less than 200 may not necessarily be a sign of good health. Does that sound familiar? That's the almost exact same quote from the previous paper from completely different authors. So here's another study Looking at veterans here in the US, aged 49 to 69, they were followed for 25 years. And this paper found that the higher the total cholesterol and LDL, the better the survival. They concluded, quote, "The current study demonstrated that higher total cholesterol and LDL levels were paradoxically and independently associated with lower risk of all-cause mortality and better survival in men." Now you might say, yeah, but that was just men. Okay, let's look at another paper in the British Medical Journal that did an analysis of 19 other studies, including almost 70,000 people over 60 years old, and examined the relationship between LDL and mortality. And they concluded high LDL is inversely associated with mortality in most people over 60 years old. This finding is inconsistent with the cholesterol hypothesis that cholesterol, particularly LDL, is inherently atherogenic, since elderly people with high LDL live as long or longer than those with low LDL. Our analysis provides reason to question the validity of the cholesterol hypothesis. Okay, so before you just go stop taking your cholesterol lowering medication because of this video, let me remind you there is a relationship between cholesterol and total mortality and cardiovascular disease. It's just much more nuanced and complex than just basing it off some large-based population study. We need to look at other factors like your metabolic health. We need to look at the coronary artery calcium score. We need to look at oxidized LDL. We need to look at lipid particle size, your family history, your blood pressure. All of these different factors play a role in figuring out whether or not you should really be concerned about your total cholesterol levels. So basing your decision on whether or not you should be concerned about your cholesterol level based on these large scale studies is really kind of just silly. But if you are going to do that, or if somebody that you know or is recommending you on your health is going to do that, let's just keep that into context in terms of these large studies are really saying your ideal cholesterol level is probably somewhere between 210 to 250. And then you might be wondering, okay, well, why would low cholesterol be a bad thing, right? I mean, cholesterol is the boogeyman of health these days. Well, it's because cholesterol is a really important compound in your body, right? It's a lipid, it's a sterol that's made by your body, and it makes it for a reason. Cholesterol is used to assist in making vitamin D, right? Cholesterol is the root backbone for most of your steroid hormones, including testosterone, estrogen, androstenedione, DHEA, progesterone, and even other hormones like cortisol. But it's also used to make bile salts, right? The liver and the gallbladder will secrete bile salts so that you can digest fats and digest your food. And then it's also used by the gut microbiome. It's used to make the sheaths for nerves. It's used to make cell membranes. Cholesterol is really important for a number of different functions in our body. So as I promised at the beginning of the video, let's take a look at a couple different comparisons. So we have two different people in their mid-50s. Person A has a cholesterol level of 240, and person B also has a cholesterol level of 240. Person A, however, also has a coronary artery calcium score of 350, and person B has a coronary artery calcium score of 0. Now remember from the previous video that I did on coronary artery calcium, it's telling us how much damage has been done to the blood vessel walls, and it's the best predictor of cardiovascular risk in the future. And person B has a coronary artery calcium score of 0, meaning their blood vessel wall health is looking really good. Now also, person A has a HOMA-IR score of 4, while person B has a HOMA-IR score of 1.5, meaning person A is probably insulin resistant, if not already diabetic. Now, HOMA-IR we talked about in a previous video, and it's a fantastic indication of metabolic health, and according to different studies, it's a much better predictor of cardiovascular disease than cholesterol is. After that, we can look at Lp(a), oxidized LDL, blood pressure, and many other things. So taking all this into context is a much better way of determining whether or not cholesterol is something you need to be concerned with. So put your total cholesterol in context of the rest of your health. Don't put the blinders on and just be concerned about your total cholesterol and nothing else. And certainly don't make any decisions on medication based strictly on your total cholesterol and nothing else. Before you make any decisions, make sure you know at least 3 things. The status of your metabolic health in terms of your fasting insulin and glucose and hemoglobin A1C and HOMA-IR, as well as your coronary artery calcium score, which we've done another video on before. And then just your overall lifestyle, right? What's your sleep like? What's your exercise level like? What's your diet like? What's your stress like? Those things play a huge role in your cardiovascular risk and your overall mortality. So we're always here to answer any questions and provide more clarity. If you want, just give us a shout at the office at 209-532-1288 or reach us through email info@peakperformancecare. All right, till next time, take care.